Are you suffering from knee pain and looking for non-surgical treatments? It's a question many people ask, and today, we're here to provide some answers. We're going to discuss a variety of non-surgical treatments that can help alleviate knee pain and improve your quality of life. We'll touch on physical therapy, medication, injections, braces, and even lifestyle changes that can make a significant difference. Stay with us as we delve into each of these treatments. First, let's discuss physical therapy. Now, physical therapy plays a crucial role in not only reducing knee pain but also improving your mobility. It's a non-surgical treatment that focuses on strengthening the muscles around your knee and enhancing flexibility. Imagine this: your knee is a city, and the muscles are the walls protecting it. When the walls are strong and flexible, the city is less likely to suffer damage. That's exactly what physical therapy does for your knee. It fortifies those protective walls. Your physical therapist will guide you through a variety of exercises tailored specifically for you. These may include stretching, strength training, and low-impact aerobic conditioning. Techniques like ultrasound or ice may also be used to alleviate pain and inflammation. Remember, consistency is key. These exercises must be done regularly, under the supervision of a trained therapist to ensure maximum benefit. And it's not just about the sessions with your therapist. They'll arm you with a set of exercises to do at home, turning your living room into your personal gym. This way, the benefits of the therapy extend far beyond the walls of the clinic. Physical therapy, when done correctly, can be a highly effective treatment for knee pain. Next, we'll talk about injections and medications. When knee pain becomes a hurdle in your daily life, these treatments can provide much-needed relief, often without the need for surgical intervention. Let's start with corticosteroid injections. These potent anti-inflammatories are injected directly into your knee joint, providing temporary respite from pain. Imagine a cool wave washing over a hot, inflamed area. That's what corticosteroids do. But remember, they're not a long-term solution and should be used sparingly under the guidance of a healthcare professional. Now let's move on to hyaluronic acid injections. Our knees are like a well-oiled machine, and hyaluronic acid is that oil. It's a naturally occurring substance that helps lubricate the knee joint, allowing smooth and painless movement. When you're experiencing knee pain, a hyaluronic acid injection can help replenish this natural lubricant, improving mobility and reducing discomfort. Next in line, we have platelet-rich plasma injections, often referred to as PRP. This is a treatment that uses your own blood to heal your knee. The blood is spun in a centrifuge to separate the platelets, which are then injected back into your knee. These platelets are like tiny little repairmen, working to stimulate healing and reduce inflammation in the knee. Finally, let's discuss arthrosamid treatment. This is a synthetic gel-like substance that's injected into the knee joint. Think of it as a cushion that helps reduce pain and inflammation, making movement easier and less painful. These injections and medications offer a variety of ways to manage knee pain without surgery. It's all about finding the right treatment that works for you in consultation with your healthcare provider. Remember, the goal is to get you moving freely and living your life without the burden of knee pain. Now, let's move on to braces and lifestyle changes. When it comes to non-surgical treatments for knee pain, knee braces are a fantastic tool. They provide much-needed support and stability during physical activities. Think of them as a crutch for your knee, offering a helping hand when the going gets tough. They work by reducing pressure on the knee joints and helping distribute weight more evenly. This can be a game changer for those with knee pain, providing a sense of relief and allowing you to continue activities you love with less discomfort. But braces are just part of the solution. Lifestyle changes, particularly in the realms of exercise and diet, can have a profound impact on managing knee pain. Regular physical activity helps strengthen the muscles around the knee, providing additional support and reducing the strain on the joint itself. A balanced diet, rich in anti-inflammatory foods, can help manage inflammation, a common culprit in knee pain. Supplements can also play a part in this equation. Certain supplements, such as glucosamine and chondroitin, are known to support joint health and can be a helpful part of a comprehensive approach to knee pain management. As always, it's essential to talk to your healthcare provider before starting any new supplement regimen. In conclusion, it's not just about treating the symptoms of knee pain. It's about adopting a holistic approach that includes physical support from braces, regular exercise, a balanced diet, and potentially the addition of certain supplements. Braces, coupled with lifestyle changes, can play a significant role in managing knee pain. To wrap things up, let's summarize what we've discussed. We've journeyed through a variety of non-surgical treatments for knee pain, each with its unique benefits. We've seen how the world of physical therapy opens up a realm of exercises to strengthen your knee and improve flexibility, helping you regain mobility and reduce pain. We've also delved into the world of injections and medications, exploring how they can provide temporary relief for knee pain. We've touched on corticosteroid injections, which can reduce inflammation and provide relief, albeit temporarily. Then we looked at hyaluronic acid injections, which can improve lubrication in the knee joint, and platelet-rich plasma injections that stimulate healing and reduce inflammation. We also discussed a relatively new treatment, arthrosamid, a synthetic gel-like substance injected into the knee joint that has the potential to reduce pain and inflammation. Next, we explored the role of knee braces in providing support and stability during physical activities, potentially reducing the risk of injury and helping manage pain. Finally, we've talked about the importance of supplements and lifestyle changes. We've seen how a balanced diet, regular exercise, and maintaining a healthy weight can significantly impact your knee health. In essence, these non-surgical treatments offer a multifaceted approach to managing knee pain, combining medical interventions, physical support, and lifestyle modifications. The goal is not just to manage pain, but to improve overall knee health and functionality, enhancing your quality of life. Remember, knee pain doesn't always require surgery. There are numerous non-surgical treatments available that can help manage your pain and improve your quality of life. If you enjoyed this content, consider supporting my channel by liking this video and subscribing for more valuable insights on your journey to a healthier and happier lifestyle. Thumbs up for this video.